Advances in Medical Imaging.
Hi, I'm Tracy. I'm a patient with Crohn's disease, and I'm also an abdominal radiologist. We've used imaging quite a lot over the past 17 years to diagnose and follow my disease. My disease was first picked up on CT scan, and that allowed my gastroenterologist to narrow in on what therapy I needed.
My name is Christine Zachariason, and I live with epilepsy. My surgeon's success in going deep into my brain and doing the least amount of damage in the process was only possible because of advanced imaging technology.
Hi, my name is Isam Laboon, and I have hydrocephalus. I am 20 years old, and since I can remember, I think at least once a year, I've probably had, doctor visits and CT scans and MRIs.
I have a son that's a year and a half, and he is living with hydrocephalus. He's had a ton of MRIs and CAT scans and a whole bunch of exams.
My name is Carolyn Murrah, and I live in the Fort Worth, Texas area. And I was diagnosed a little over 5 years ago with stage 4 colon cancer. Over those first few years, I had every kind of scan that I think is available.
Interventional radiology played a major role in my health because without it, the doctor would have never been able to see my moderate to severe condition. The doctor was able to perform surgery with the guide of live MRI and successfully embolize and remove the veins. Without imaging, the pelvic congestion would have never been found and would have led me down the path of pain management instead of curing my chronic issue.
In April of 2017, I went to my doctor's office with the worst headache of my life. Unfortunately, my doctor did not order imaging. 6 days later, I suffered a ruptured brain aneurysm which almost killed me. During that time, I also realized or found out that I had a second unruptured aneurysm. So now I constantly get imaging done on a regular basis so that if the second aneurysm should decide to try to harm me in any way, my doctors now will go in and they'll address the situation.
When I think about advances in medical imaging technology, I think that anything that would make the job of my surgeon, my daughter's surgeon, easier is to our benefit.
When I hear that they're starting to do a 3D MRI of the brain, it makes me feel more hopeful, which it would be better of a process for us than having to go through like a regular MRI or CAT scan.
Research has a great impact on the care of my patients. It's the research in imaging and image-guided therapies that allow me to come up with new techniques to treat my patients, to take care of their enlarged prostates, their fibroids that are bleeding, and the cancers that kill them. This type of therapy is critical to the future health of our nation.
Where we need additional investment is in how we can take care of the most number of people in need using the technology that we currently have or the technology that we will develop under constrained resources. And continued investment in this type of imaging research will allow us to serve the most number of individuals in need.
Increased funding for biomedical imaging research is important to the research community, it's important to our academic institutions, and most of all, it's important to our patients. Imaging touches every disease, and advances in imaging technology, image-guided therapy, and image processing can help improve the lives of many patients that could benefit from it.
So for me, lack of imaging almost killed me, and now that I get regularly scheduled imaging, quite frankly, it could save my life. So the message really is, when in doubt, do the test.
But I hope that my situation helps someone else to know that the diagnosis, the remedy, and the future prevention of all my problems were solved with medical imaging. Without it, I wouldn't be here to tell you my story.
Please continue to fund this vital medical technology that is leading to new innovations all the time.